Smoke from the Long Lake wildfire is creating air quality issues in some parts of the province. Winds are driving plumes of smoke as far as 100 kilometers from the Annapolis Valley fire. Environment Canada has issued air quality warnings for several counties. Dr. Jennifer Cram is Provincial Medical Officer of Health. So first off, let's start with the risks posed by this wildfire smoke.
Yeah, thanks so much for having me here today to talk about the health impacts of reduced air quality. Before I get into that, I just wanted to, express my extreme condolences to people who have been evacuated during this event, and for those who have so unfortunately lost their homes. We're going to talk about the health impacts of reduced air quality from wildfire smoke today, but I didn't want to lose sight of the extreme emotional and mental health toll that those people are going through. With the wildfire smoke comes the components that make up wildfire smoke, which is different gases as well as fine particulate matter, and those components can go on to cause health issues for some people more than others. But really, when air quality is very poor, everybody, regardless of age and health conditions, can be at risk. So some things that you could experience if you're in an area with reduced air quality due to that smoke would be irritation of the eyes, the throat, the nose, and then people, especially people with underlying respiratory illnesses like asthma or COPD, can really experience a flare-up or worsening of those conditions. And additionally, people with underlying heart disease can also experience worsening of symptoms associated with that. And so, as I said before, while everyone's at risk when the air quality alerts are at a high level, some groups are more vulnerable even when the levels are more in the moderate range. And so that would include elderly people over the age of like 65, very young children and infants, pregnant people, people who smoke, people who have to work outdoors despite the conditions, and then people with underlying health conditions, especially those lung and heart conditions.
So what can people do to protect themselves? I say, does wearing a mask outdoors help? But what can people do?
My top recommendation would be to follow the air quality alerts that Environment Canada puts out. They use the Air Quality Health Index, which uses a low, moderate, and high rating, and know what's going on in your area. The additional monitoring that we have in Nova Scotia is also something called the Purple Air Monitoring System, which can provide real-time updates and has broader coverage throughout the province. And that can be really useful as those winds shift to see when those numbers are climbing up and then when they go back down again. So know the risk in your area to inform the steps that you can take. And if you're seeing that smoke is causing that air quality to go into the moderate or high range, that's the time to start thinking about taking action depending on the risks that you as an individual face. So important things to do is, if possible, remove yourself from the smoky situation. So that means going indoors, keeping the windows closed, and just keeping things as tight indoors as you can. Be aware of what sort of cooling system your home has or the indoor space has. If it's one that involves fresh air intake, turn that off if possible, or have a good quality filter in place. If your home is not one that where you feel that you can take those actions to reduce the amount of smoke coming indoors, then look for places in your area. There might be libraries that are open or other public spaces where you could go to take a break.
So how long can the particulates hang in the air?
That will depend on the wind, both the wind direction and other characteristics that Environment Canada may give more information about. It can really vary, though, depending on things like wind direction. And so that's where that purple air monitor with those real-time updates can be really useful.
Now, do you have to see and smell the smoke for it to be dangerous?
Not necessarily. You're not going to, the particulate matter we often call PM 2.5, and that speaks to the really tiny particles that can go deep into the lungs. And you're not going to be able to smell those. I mean, certainly smelling smoke in the air is one indicator, but I would really encourage people to look at the monitoring systems to give them a more realistic sense of what the air quality is like in their area.
All right, some good advice. Dr. Cram, thank you so much for your time. We appreciate it.
Happy to be here.